There are at least 4 new COVID variants in the U.S., and health experts are calling this especially concerning. And researchers say they've now discovered a new variant of the virus in New York City, and it is spreading quickly.
And there is another seemingly state-specific COVID variant that's been discovered in California that's also spreading quickly. Scientists say the variant was discovered last May, and it evades antibodies generated by COVID-19 vaccines from prior coronavirus infections.
Joining us now to talk about these new coronavirus mutations and if we should be concerned about them here in Mississippi is Dr. Timothy Quinn of Quinn Family Healthcare in Ridgeland. Dr. Quinn, as always, thank you for joining us today.
Hey, thank you for having me.
We've heard about the UK and South African variants that have already been found in the U.S., even here in Mississippi. But how concerned should we be about these new variants associated with specific states?
Well, I mean, this is very, very concerning to the scientific community because what's happening is these mutations, and it's actually very fascinating. What happens is when a person is infected with the coronavirus, then the virus replicates and replicates and replicates. But during this replication process, there can be mistakes. But what's happening is some of these mistakes are giving the new virus an advantage. And this advantage that keeps popping up in these new variants is the ability to better infect someone. It's with that spike protein, that part of the virus that attaches to human cells and allows the cell to be infected with the virus. It's more effective, and that's not good news at this time.
So the current coronavirus vaccines seem to be less effective against these new strains. So how concerned should we be about that?
Well, we should be concerned because the research is showing that this advantageous mutation that these new viruses have, these new coronavirus strains, they have somewhat of an advantage with the vaccination. But the good news is the research is still showing that the viruses are still affected as far as with our vaccinations, meaning the vaccinations work, they just might not work quite as well. They're showing that people that get the vaccination have still a very good chance of not suffering severe consequences from the virus as opposed to if they were not vaccinated. Meaning, if you get your vaccination, there's less of a chance that you'll be severely sick in ICU in the hospital on the ventilator or even lose your life. But with this new mutated strain, it looks like the vaccinations work, but we still might have a better chance of getting coronavirus, but just less consequences.
Oh.
Well, could a Mississippi-specific variant develop here, and should we expect other variants to emerge?
Most definitely, but what we can do is we can fight back. The best way to fight back so that we can slow down these mutations is slow down the infections. Because remember, the only way for mutations to occur is for a lot of people to get infected. And the more people that get infected, the more likely that we'll get these mutations. So we have to continue to wear our mask. We have to continue to social distance and follow the recommendations of our healthcare officials. And also, let's get vaccinated and get as close to herd immunity as possible. And that way we can slow down the infection rate, and we'll slow down the mutation rate, and we'll be more likely to reach that safe place where we deserve to be, and we so need it.
Well, thank you, Dr. Quinn. Thank you for giving us some encouraging words here on Friday afternoon. Thank you for sharing a part of your Friday with us, too. Appreciate that.
Yes, sir. Thank you.